Good evening, everybody. So it's time to begin our webinar. I do apologize. We are having some technical problems with getting the PPT up. So while that is happening, I thought I will continue with the webinar. So today's webinar really is about the fundamental aspect of what is new in the management of autism, as well as cerebral palsy and intellectual disability. So all of us attending this webinar are here because we have children with special needs. You have gone from pillar to post. You have met doctors and therapists. You've searched the internet and you've done everything that you can to help the children. However, there are developments in medicine, in particularly some of the work we do at NeuroGen, that are very, very exciting indeed. And this talk is an informative talk. It's a talk about letting you know what is new for our children. We are going to divide this talk into few segments. The first segment is we are going to highlight uh, the new light, the new attention that autism is getting, right from the President of the United States to the Health Secretary of the United States. All right, dear friends, I'm back again and the PPT is finally ready. I once again apologize for the technical glitch. So today we are going to do what we call a 360-degree approach to the management of autism. That's what we're going to look at today. I'm Dr. Alok Sharma, a neurosurgeon and director of the NeuroGen Brain and Spine Institute. So the first thing about autism, is its increasing prevalence. So if you look at this slide, in 1970, the incidence of autism was 1 in 10,000 children. And in 2025, it has become 1 in 31. If you look at it in 1995, it was 1 in 1,000. So just look at the increase. This is a graphic from the US CDC, and there is something really seriously wrong with the increase with which autism is happening in our children. So this is alarming, this is frightening, this is a matter of concern, and this is something which I think the health authorities, regulators, governments need to look at. What is happening? Why is it that autism is increasing so much? So if you see, there are about 70 million families affected, which is about 1% of the world population. So the conventional treatment of autism, and all of you have been through this, is first, the moment you see the symptoms, you go either to a pediatrician or a psychologist. You're given a diagnosis, and very often it's the first time you've heard the word autism. You're advised rehabilitation therapies. You may be advised some medications for hyperactivity. In the majority of cases, no investigations are done. Nobody looks at the brain, and there is not a detailed evaluation. And you are told that there is no definitive treatment. This is what has happened to almost all of you listening to this webinar. But here's the new approach. The first is after the clinical diagnosis, we do a brain imaging. We do two forms of imaging, an MRI and a PET CT scan. We do several routine and specialized biochemical investigations. We do genetic testing. We look at the gut microbiome. We have a comprehensive rehab program. Our mainstay, of course, is the cell therapy. Then we have added now integrative oxygen-based therapies. We do micronutrient supplementation. Of late, there is the new medication leucovorin, and we do gut cleansing. So from being told that nothing can be done for your child, you have a whole lot of things that can be done that we are already doing. And all these not only give us more information, but they also offer treatments that give our children the opportunity to lead independent and productive lives. So here's this video that, which shows what the President of the United States, what the Health Secretary, equivalent to the Health Minister of the United States, and what the FDA commissioner have to say on this subject. So this is President Donald Trump.
Been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. It's 1 in 12 or 1 in 31, and now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%.
And this is what the health
Through autism for pregnant women, infants and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism.
Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells.
So this is very recent, just about a little over a month ago. So I'm going to, before I get on to our treatments, I'm going to explain what these three gentlemen have said. So these words are confusing, but we have vitamins in our body. You all have heard of the various B complex vitamins. So there is a B9 that we refer to as folate. Now, the way we take it orally is in the form of folic acid. This is an inactive form, and this has to be converted to an active form called folinic acid. So what happens, and I'll explain to you later, is in our children with autism, this conversion is not happening. So just remember, to make it simple, we are talking of vitamin B9, all right? We take it in an inactive form. It has to be converted into an active form for the brain to absorb it. And that is not happening in our children. So what is really folate deficiency? These are all technical things, but it's just to let you know that if the brain of a developing child in the first few years does not get enough folate, then the brain development is affected. And this can also happen because of the presence of something called antibodies, which is, we have, all our cells have something called receptors that allow things to come in. And because of these antibodies, there is, it's sort of like there's a gate and somebody's blocking the gate. And so important things are not going into the brain. This is called cerebral folate deficiency. This leads to a whole lot of symptoms. I won't go into very technical details. I'm just trying to simplify this for you. So what exactly, because today almost everybody wants to know about leucovorin. So what exactly is leucovorin? Basically, this is called folinic acid, which is different from folic acid. I know the names sound confusing. Folic acid is the inactive form. Folinic acid, which is leucovorin, is actually an active form of B9. And it doesn't have to go through conversion steps, so it can bypass the blockage. Just to let you know. So here is a drug. When we take it, we actually bypass the block. Now, what are the clinical benefits of leucovorin? One, what we have noticed, and by the way, although the US FDA approved this just about a month ago, we have been using it for a little over 2 years already at NeuroGen. So we have been using this for a long time, and we have a very extensive experience on the use of leucovorin. We found that the speech improves significantly. So one of the main effects of leucovorin is that the speech improves. And what we have found it when we combine it with our treatments, like our stem cell therapy or our oxygen-based therapies, we find that speech is coming a little faster. There also improved social interaction and eye contact, but there are some problems, and the main problems is it does cause behavioral issues. There is hyperactivity. There are some sleep disturbances. So although there are benefits, but there are also certain side effects. So we've been using this for some time now, and we've seen improvements in speech. Now, This is a little technical. It's a little difficult for you to understand, but again, this is part of what I said. There is an important vitamin B9 folate that has to get into the brains of our kids. And because of something called an antibody, it's not able to enter. And this causes a cerebral folate deficiency. So today we are understanding what exactly is happening in the brains of these kids and why their brains aren't developing like other neurotypical children. In the press interview, President Donald Trump spoke about the role of paracetamol taken in pregnancy and the use of it in autism. We don't have much information on this. This was something which was spoken about in America, but we don't have much of an information on this. So, what I spoke to you about was to explain what President Donald Trump, what RFK Jr., and what the US FDA commissioner said. I tried to simplify it. We don't have so much time, so I couldn't go into details, but I just gave you a broad understanding. Now I'm going to tell you the insights that we have had from our own work. From genes to the gut-brain axis, from biochemistry to brain imaging. We are going to look at our research and how this has shed a complete new light on the management of autism. So we will look at, of course, genetic findings. We will look at biochemical findings. We look at the gut, and we will look at neuroimaging. So these are the four main things we are going to look at. So let's look at the genetic findings. What we have found, again, this is to explain to you what I said earlier, that we take folic acid in an inactive form. It has to be converted into an active form for normal brain functioning. But there is a gene, the MTHFR gene, that plays an important role in converting inactive to active. I'll repeat again. There is a gene, the MTHFR gene, which is responsible for converting inactive folic acid into its active form. And what our work, so if this gene is inactive, you can give as much supplementation, you can give as much vitamin levels, but it will not convert into the usable form. And what we have found, and this results in cerebral folate deficiency. So our data shows that 73%, I'll repeat that, 73% of our children have a problem with this gene, which means out of every 100 children, 73 children cannot convert inactive folic acid to its active form. Now, this is a very large data, and it shows that this is something very important. Now, the thing is, this is not being tested. What is happening all over the world is we make a diagnosis of autism, and then we don't go and proceed to do all these tests. These are simple blood tests, and they will tell us if our child has a genetic mutation. So this is our data, 73% out of all our patients. This is again a little technical slide to show you, how there is blockage of the receptor. It's like, if you can show you if there's a blockage, then the folic acid that we take in our food cannot get in because the entry is blocked. So by using glucoverin or folinic acid, you bypass that. You bypass this block. And this is, a lot of data worldwide, which actually shows its benefits. So the second thing that I'd like to show you, this is our research. So the first part of our research was 73% of the children on the autism spectrum have a gene mutation, a genetic defect, because of which inactive folic acid doesn't become active and the brain is deprived of folate in a very simple way. Now, the next thing is our biochemical finding. This is all part of our own research. So we've actually been looking into the blood neurotransmitter levels, and we found that the following: phenylethylamine, tyrosine, dopamine, histamine, GABA, these are all names, they may be alien to you, but we are actually finding that all these neurotransmitters are less in the brain. We are also finding some neurotransmitters like serotonin, glutamate, and epinephrine, which are higher, which means there is an imbalance of neural chemistry in the brain. Some neurotransmitters are low and some are less. And this actually explains everything. It explains the speech deficits in our children. It explains the hyperactivity of our children. So this is data from our own patients, from over 500 patients. We've got this data. And these are some other things, these are technical names, but again, just to let you know that there are neurotransmitters or chemicals in the brain which are less and some are more. So we've also found that in almost half the children, vitamin D is low, 46%. 1 out of 2 children with autism have low vitamin D levels. And correcting that also helps these children. Now, this is something very simple. Vitamin D level can be done anywhere, but we aren't doing it. What we've also found is that vitamin B9 folic acid is high in 81% of the kids with autism. So what we do is we keep on giving supplementation to our children without knowing these levels. 81, now this is very important, please understand. 80 out of 100 children with autism have higher levels of B9. You know why they are high? Because they are not going into the brain. But we keep on giving them folic acid in an inactive form. Now, this high levels also cause a problem and a damage. So we have to identify. The point I'm trying to make is there are a lot of very simple tests that can guide us to help our children improve. So we must do vitamin D levels. We must do vitamin B9 levels. Then there's also what is called the gut microbiome testing. The gut microbiome testing is not just a stool test. It's a very detailed test that tells us a whole lot of issues. And we all know that the gut has a direct connection to the brain. And we're all aware that there are several symptoms which are gut connected. So this is the data that we found. So these are probiotics, which, and we find that in the percentage of individuals in which many of these things were less. So they are supposed to be a certain normal level, which helps in keeping a balance within the gut. And you can see on the left side are the names of the probiotics, and on the column you can see in what percentage of these kids they were missing. All right. So the gut, there is this, these are good things. These are things we must have, and they are missing in the children of our kids with autism. Again, here you will see there are several pro and prebiotics which should be present, but we are finding that they're actually missing. On the other hand, these are infections. So E. coli is a bacterial infection, Shigella is an infection, Candida. So these are infections that our kids have. So they have fungal infections, they have bacterial infections, and all these are correctable with very simple medications. But unfortunately, these are not being investigated. So you have to look into the gut of our children and correct all these gut problems. And again, these what I told you, the vitamin levels with high and low levels, and the various neurotransmitter levels. These are all technical data. And now I come to the neuroimaging. So we discussed the genetic problem. We discussed problems in the biochemistry. We looked at problems in the gut, and now we will look at problems in the brain. So there are two kinds of brain scans. There is a PET-CT scan, which is in color, and there's an MRI in black and white. We all are familiar with the MRI, but we are not familiar with the PET-CT scan. Some of your children may have had an MRI of the brain done, but the PET-CT scan almost nobody is doing. But this gives us extremely valuable information. So in our data, and we have now treated a little over 7,000 children with autism, another 3,000 children with cerebral palsy. And in the 7,000 children, we found that, these are color scans where the green is normal, but the blue is damaged. So you can see this blue in our children, and every child with autism has this blue damage. The speech area, the attention, the concentration, the coordination areas are blue and not working. It's called hypometabolic, which means these are parts of the brain that are not working. These are just the technical terms of the areas which are hypometabolic: the cerebellum, which is the small brain, the amygdala, hippocampus, parahippocampal gyrus, which is part of what is called the limbic system, is in the medial part of the brain. So for the first time, we've actually, I'm sorry, we've actually shown the world that there are parts of the brains in our children with autism that are not working appropriately. They are working lesser. and all the symptoms are because of that. But we've also noticed something very interesting. We've noticed that there are parts of the brain, which some of the cortical frontal areas, the parieto-occipitally, the visual area, which are actually working more than a normal people. This may partly explains some of the hyperactive behavior, but it also explains their super intelligence. It shows that they have an intelligence more than us neurotypical people. So, up to now, the world used to focus on what these children can't do. We at NeuroGen have shown through the brain scans their exceptional abilities and have clearly shown that there are many things that they can actually do more or better than us. And this is published in a very prestigious journal, the World Journal of Nuclear Medicine. This is our paper, where we were among the first to show what are the problems, what are the metabolic changes in the brains of children with autism. Now, in our paper, we found something interesting. We found that this is data from a paper that the brain function keeps on decreasing with age. I want you to have a look at this slide. So the blue line is the brain activity in children with autism, and you can see from 3-5 year onwards to it keeps on decreasing up to 15 years. So there's a decline. You know, when you do this for about 2-3 years, it is a particular level, and then it keeps on declining. Now, typically developing children, what we call neurotypical, actually keeps on increasing. So in children who don't have autism, the brain activity increases. In children who have autism, the brain activity decreases. But there's something very interesting in this. And what is interesting in this is that the brain activity of children on the autism spectrum, they start higher. At 2-3 years, their brain activity is more and then it declines. Whereas in children, it is lesser to begin with and then increases. Now, this shows why we should do the treatment early, the whole concept of early intervention, because the earlier you treat, the lesser gap you have to bridge. If you treat at 10, 11, 12, 15, you have to bridge this gap. If you treat early, you have to bridge this gap. So, because people keep saying, let's wait till, this treatment is more established, more available. But please remember, the longer you wait, the bigger this gap will be between your child with autism and a child on the spectrum. So that was about PET CT scan. We've also done a lot of research on the MRI of the brain, and our brain, as you're aware, has got a right and a left side, and there's a bridge between them. It's called the corpus callosum. It's a bridge that connects the left and right side of the brain. And what we found in our research is that this bridge, or the corpus callosum, is smaller in children on the spectrum as compared to neurotypical kids. And again, this work is published, or this is published in a scientific paper where we have documented and shown that the bridge connecting the two sides is smaller in children. This had not been seen before by anybody. We were among the first people to, from our research, to show this. So basically, what we have found we have found that 73% of our kids have a gene mutation, 81% have high folic levels, and since 1998, there's been a tremendous increase, and maybe one of the causes is that 1998 onwards, two things happened. WHO suggested folic acid supplementation for mothers, and the food, all cereal grain, maize, wheat, etc., in the United States and Canada started getting folic acid supplementation. And ever since this has started out, this was very important because this supplementation was to prevent some birth neural tube defects in the mothers. And it did work because the incidence of that came down. But there could possibly be a connection between this and the increasing incidence of autism. So there are several, in this talk, I will not go into the causes of autism because that's a separate topic all by itself. It takes me about a 3-hour talk to just discuss the causes. But broadly speaking, you could divide them into environmental, which could be, heavy metals. There is this various medications used early in life. Vaccination, this is, a very controversial topic, exposure to chemicals and electromagnetic radiation from mobile phones. There are some patient-related factors like older age of parents, the health condition of the mother, stressful family life, certain genetic factors, and nutritional deficiencies. Like I said, I'm not going into details in this, But in 1998, Andrew Wakefield published a paper that showed the link between MMR and autism. However, this paper was retracted because of objections. And then there are several other publications later that showed about 25 articles that showed that it does not cause autism. But the jury is still out on that. We have a couple of hundred parents who've told us that the child was doing well. They took the vaccine and the child regressed. So, what I spoke up to now was investigations. We've not even come to the treatment. We are just looking at investigations, which I believe are not being done in the kids. So, for your children, please, we need to get a brain imaging in the form of PET MRI. We need to look at the genetic problems, their blood tests, see the micronutrient deficiencies increase, and look at the gut. When we do all of this, we get a very solid picture of what's happening to a child. But this information is not enough. We need to help the child. So, let's look and see how we can what we call a 360-degree approach. So there was an old thinking. This is a 100-year-old, more than 150-year-old thinking that once the nervous system is damaged, it does not regenerate. However, the newer thinking is that you can repair the nervous system by cellular replacement. So we will now look at the topic that you all are primarily attending this webinar. You all here primarily want to know what is this cell or stem cell therapy. But I always believe when we give a talk, you have to give a talk of all the topics because the cell stem cell therapy is one part. It has to be understood in the overall context. All right. But let's have a brief look at what are cell stem cells. So cell therapy is it's a new field of medicine. We call it the field of regenerative medicine. It's a very promising therapeutic modality where what do? We take healthy, good cells and replace the damaged cells. So, if there is damage to the brain, once you put the stem cells, the damage goes away. So, I like to show this kind of a picture. On the left-hand side, you will see a bone that's damaged. Right, this is fractured. Can you see this? That's a fractured bone of the leg. This is the foot, and this is the lower parts of the bone of the leg. Now, I ask you, if God forbid you were to ever have a fracture like this, would you do physiotherapy on a broken bone? Would you go to a rehabilitation therapist and say, give me therapy? My bone is broken and I want to give therapy. Would you try that? No, you would not. Because you can't do therapy on a damaged leg. You can't stand on it or walk on it. What we do is you go to an orthopedic doctor. He would put some plates and screws and a plaster and fix the broken part. And now, on top of this, you would do therapy. But with our kids with autism, we do the exact opposite. Here is a PET CT scan of a child on the spectrum. You can see the blue is the damaged part, and we are giving rehabilitation on a damaged brain. We are expecting a child to talk when the speech area is totally non-functional. All right. It's not possible. You can do whatever you want. This brain is not working, and so no therapy of the world is going to be able to give you results because the brain itself is not working. And I believe that when you push children to do things that their brain can't do, it is very unfair to them. It is like making, if you had a fracture of the leg and I forced you to run, how would you feel? That's exactly how our children feel now because their brain can't do things and we are forcing them and forcing them and forcing them to do things. But what if? What if we repaired the brain? Okay, what if this brain became active again? And now we did therapy. You would get very good results. And this is exactly what we do. Unfortunately, nobody's even forget trying to repair the scans. Nobody is doing scans to know what the damage is. This is the one thing which makes no sense. If you had a fracture of the leg, would you or would you not do an X-ray? If you have a problem with your abdomen, would you or would you not do an ultrasound? Okay, if you had a stone, a kidney stone or a gallstone, you would do an ultrasound, right? But our children have a brain problem and nobody is even looking at their brains. All right. But now we have shown that this is the damage, but most important, we have shown that this damage can be corrected. And we have over 7,000 scans before and after that show that the brain in the children with autism can be repaired, it can be fixed, the hypometabolic areas can be made normometabolic, and we can give our children that opportunity, that chance to be able to lead close to independent normal lives. So if you look at the worldwide publications on cell therapy, you'll see there are close to 47 papers already in autism, 62 in cerebral palsy, and there are several papers on spinal cord injury, head injury. These are worldwide publications. So it's not a new science. There are people all over the world who are actually doing this. So how exactly do cells or stem cells work? So the first thing that they do is they have the ability to multiply. So a single cell can become into several million cells. So that's one major advantage. Second, and most important, a single stem cell can become any cell. It can become the same cell can become a nerve cell when you put in the brain. It can become a heart cell if you put it in the heart. It can become a muscle cell when you put it in the muscle. So depending on where you put it, this will become the cell that you want. That's the beauty. I mean, imagine a cell that you could convert into anything that you wanted. You could make it a heart or a brain or a muscle depending on where you put it. So you take the cell and we put it in the brain through the spinal fluid, they become brain cells. In a condition such as muscular dystrophy, we put it in the muscles and they become muscle cells. So that's the excitement. They not only convert, but they also multiply. They also improve the blood supply. So, once you put the cells, they attract fresh blood towards it. And they also release certain positive chemicals called growth factors. And then these chemicals have a very positive healing effect. So the combination of all of this results in repairing, regenerating, and replacing the damaged tissues. I'll repeat that: we repair, we regenerate, and we replace the damaged tissue. Now, this is a more medical slide. These are medical terms to show you how the cells or stem cells work. Angiogenesis is improved blood. Paracrine effect is more hormones. Anti-apoptosis is to prevent cell death. Neuroprotection is to help, protect the neurons, improve the connection between the nerves. That's called synaptic plasticity. They stimulate the existing stem cells in the brain and they reduce inflammation and improve the immune system. So that's just a technical explanation of what they do. There are two broad kinds of cells or stem cells. One is when you take it from your own body or from your own child and put it back into the child or put it back into your own body. This is called autologous. This is a procedure, and that's why, from a regulatory point of view, comes as a medical procedure. On the other hand, you have some companies that manufacture stem cells. They take it from the umbilical cord of kids. The umbilical cord is a cord that connects the mother and baby at birth. They go to various hospitals, collect all of it. The umbilical cord has got a lot of stem cells, so they take the stem cells, package it, and sell it to hospitals and doctors. Now, this is a product. So there is a difference between a procedure and a product. Just like if you take an orange juice and squeeze and give it to your child, that's a procedure. You've taken an orange, squeezed orange juice, and given it. On the other hand, if you buy a canned orange juice, like a Tropicana, a fruity or something, that's a product. All right. So very often people don't understand the difference between the two. A product is something which companies manufacture, they sell to hospitals and doctors, and you need an approval for selling a product. You have to go through FDA. Procedures, on the other hand, have no approval pathway. You can't go to anybody and ask for approval for a procedure because they'll say, "We don't come under us." This is a medical practice, and it is left to the doctors as to how they choose to practice it. The way we inject it back is you can inject it back, as you can see, intra. So you put a needle into the lower back, and there's a fluid in the lower back called CSF, and from that it goes onto the top. You could also inject it into the arteries, into the veins. You could give it through the nose, or you could inject it directly to the brain. We prefer this intrathecal approach. So how do we do it? There are three simple procedures. The first is we take a needle, put it into, this is the pelvic bone. So this is the hip bone, and that's the pelvic bone. We put a needle into the pelvic bone. Here's the child lying down, and we put a needle. Then with a syringe, we pull out, and we get bone marrow. This is very similar to how you collect blood. When you collect blood for a test, you put a needle into a vein, and you take out. Here, you take it out from the bone and not from a vein. It takes about 15 minutes to take this out. We give local anesthesia so the child has no pain. We give mild sedation, short-acting anesthetic, so the child is sleeping and is completely unaware, because one of the concerns of parents is my child shouldn't have pain, which we completely understand. So here's to assure you that nothing like that happens. Now, when we take this out, what do we do with it? We take it to a laboratory where we sort of filter it by running it through machines called centrifuges. We layer it out, and then we just extract the cells that we want. And this can take anywhere from about 3 to 4 hours. Uh, and then once we have the cells, with a very thin needle, we inject it into the lower back. Why the lower back? Because the fluid in the lower back goes directly to the brain. So in this whole procedure, there are only two needle pricks. With one needle, we take out. With one needle, we put in. There is not a single cut. There is no stitch. There is no surgery. There is nothing involved. Just two needle pricks. And we are taking a child's own healthy good cells and putting it back into the child. So there is nothing from the outside, no artificial chemical agent or anything like that. So that's the wonderful nature of this procedure, just two needle pricks. So here's a video of how it is done. And you can see you can see is the bone marrow coming out. The child is sleeping. We take the bone marrow to the laboratory. Once it's separated with a very thin needle, we inject it into the lower back. I'll just show you that video once again so that uh, it's easy for you to understand. Okay, here's the needle. Child is sleeping, and we are put a needle and taking out the bone marrow. Take the bone marrow to the laboratory. Once it's ready, with a very thin needle, we inject it into the lower back. That's all there is to this procedure. Extremely simple, and so it's extremely safe. There are a whole lot of publications worldwide, but it is our pleasure and privilege that the world's first scientific paper on cell therapy for autism was published from our country, from India. It was actually published by us. And the second paper was from China, the third from Italy, the fourth and fifth were from the United States, the sixth paper was again by us. And then you have papers from other countries, including the United States, Iran, and Vietnam. And recently, I'll show you the data has just been accepted. The world's largest study, 1,011 patients, has been accepted for publication by us. I'll show you some of that data as well. So this is our paper. The first study was published in 2013. It was, an open label proof of concept study. We had 32 patients, and 91% of those patients improved. They improved in symptoms like social relationship, emotional responsibility, speech, language, behavioral patterns, sensory aspects, hyperactivity, attention, concentration, eye contact. And this is the percentage of improvements. So these are substantial, these are the main symptom complexes, and we showed all these improvements. Our second paper was published in 2020, which was in a very prestigious journal, the American Journal of Stem Cells. And this was cell transplantation as a novel therapeutic study, a clinical study. And here, again, the sample was larger, 254. We followed them up for 7.5 months. 95% of the patients showed improvement. And again, you see the same symptoms improved from social interaction, eye contact, attention, stereotypical behavior, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following, speech, communication. So you notice that all the symptoms that we are worried about, they all improve. But what was interesting was that we found that there was an age correlation. So between 0 and 5, we had a 97.77% success rate, 97.7. This is below 5. But between 5 and 10, it became 94%. Between 10 to 15, it became, again, it was 94%. And 15 and above, it was 19%. So the success rate decreases with age. This is very important to understand. For all those of you who are wondering, should we not do it? The longer you wait, the more you will go down this slope. So that is why it is important that this treatment is done as soon as is possible. This is just to show you the comparisons, on our study. So you can see above, the blue is the hypermetabolic area on the PET CT scan. And below is after cell therapy. So you can see all this damage here, and you can see it's gone. You can see all this damage here, and you can see it's gone. So for the first time in medical history, we at NeuroGen showed the world that the hypometabolic, inactive, damaged parts of the brain in children with autism can be reversed. It can be repaired. Our children can be given a chance to have a close to normal, independent, productive life. Here in front of you on this slide is the proof of that, the damage before and the improvement later. And we don't have one or two, I'm just showing you one or two, but we have over 7,000 scans like this, over 7,000 before and after, showing that the brain damage in children with autism can be reversed. So this is the new hope. This is so exciting. You've all been told that nothing could be done, and I'm showing you in front of you, in front of your eyes, you're seeing scans, you're seeing the damage that is completely dissolving and getting repaired. So yes, our children can improve once their brain damage improves. So these scans were from a machine called the Siemens company. That's one of the world's largest companies. So these are Siemens scans. We also do the scans sometimes on General Electric machines, GE. You're all familiar with General Electric. And here again, you can see that now these pictures appear different. So here you can see the damage, and here you can see the functioning coming back. So just to show you that on two different machines of two different companies, Siemens and GE, you're seeing similar findings. You're seeing before the treatment, large parts of the brain are damaged, and after the treatment, you're seeing a significant amount of the damage has been resolved. So this is after cell therapy. And this is our paper, the most recent paper, just accepted about a month ago. This is very fascinating because this is 1,011 patients. And this has been, of course, accepted for publication, should be published next month. And I'll just show you some of our data here. This is 1,011 patients. They are followed up for 19.9 months. And you can see the improvement in everything like before: attention, command following, eye contact, sitting tolerance, social interaction, hyperactivity, communication, speech, stereotypical behavior, aggressiveness, self-injurious behavior. All of them improved in the percentages which are mentioned above. So there are good improvements. Even the score. So if you take an average of the ISA or the CAR score, you can see that it improved in 859 out of 1,000, over 1,000 patients. The same thing is true about CAR. So these are the scores which improved in 85 and 87%. And again, in this paper, you can see that the results are declining with age. So as the age becomes more, the percentage results keep on becoming lesser. So again, here is before and after stem cell therapy. You can see above the damage, in the brain, and you can see post stem cell, this damage has become green. So that's the good news, that the damage in this brain can be repaired and can be fixed. So now that was about cell or stem cell therapy, but I want you to know that the brain is like a computer. A computer's got hardware and a computer's got software. Cell or stem cell therapy only and only repairs the hardware. It cannot put software. The software comes from home. It comes from parents. It comes from school. It comes from rehabilitation therapists. That's why the environment at home and the intensity and frequency of therapies and they play a very major role in improvement. So here is just to show you. So the cell therapy will repair the hardware, and the rehab and teachings software will repair. So this is, now in this talk, for want of time, I won't go into the details of therapy because all of you are familiar. The only point I want to make is children with autism need comprehensive rehab. Problem is, all over the world, different places have focused on different things. For example, in America, there is an entire focus on ABA. In some other parts of the world, the focus is on occupational therapy. In some parts of the world, it's on speech therapy. In some parts of the world, they only get special education. We believe that all of this needs to happen together. And unless it happens together, we are not going to see the best results in our children. So these are the various therapies that happen at our institute. And rehab has a positive effect on the cell therapy because it improves cell integration and survival, blood supply, connectivity. So rehabilitation actually enhances the results of cell therapy. We've already covered the science. We've covered cell therapy. I very briefly touched upon rehab, and now I'm going to look a little bit at what are called integrative therapies. Because most of these therapies, integrative therapies, you can get in your town, city, or your own countries as well. So the first of this is hyperbaric oxygen. We look at ozone and gut cleansing. So hyperbaric oxygen involves breathing pure oxygen in a pressurized chamber. That's the chamber. The parent goes in with the child. There's a screen out there where the child can watch cartoons, and most kids just love it. They feel they're in a space capsule or something. And it has tremendous benefits of improving the oxygenation, immunity, brain function, metabolism, energy levels, overall functioning. So how does hyperbaric oxygen work? So this is the chamber. As you can see, the parent and the child are very comfortably in, and they really enjoy it. It's like a fun thing, you know. So the way it works is that, see, all of us today, all of you and me, right now, as we are sitting in our rooms, homes, or offices, we are breathing oxygen at one pressure, 1 atmospheric pressure. Now, at 1 atmospheric pressure, our blood has got a liquid called plasma. It's got red cells and white cells and platelets, 3 kinds of cells. So there is no oxygen right now in our plasma. Nothing, zero. There is no oxygen in the white cells. The oxygen can only and only be carried by the red blood cells, and in the red blood cells by the hemoglobin. You all have heard that word. So only the hemoglobin in the red blood cell can take oxygen from the lungs and heart to the tissue. But when you give oxygen under pressure, double the pressure, 1.82, the oxygen goes into the liquid or the plasma. So the entire liquid is full of oxygen. That is why it has its beneficial effects. Then there is another therapy called ozone therapy, which is so oxygen is O2 and ozone is O3. The way it is given is it can be given through the ear. We sometimes give it through the rectum. We do ozone cupping, which we have seen has helped in speech recovery because we do cupping of the face. And apart from that, we have a gut detox plan where we do a gut microbiome test first. We identify what are the infections. We use ozone therapy rectal to clean this. And then we have a series of recommendations how to get the gut balance. So the gut has a very important part to play in the overall recovery because a lot of behavioral issues actually stem from what is happening in the gut. We all are familiar with this. I won't spend much time. You know, there are foods that we can give our kids which are pro and prebiotics, a ketogenic, gluten-free, casein-free, vitamin-rich diet. Things like curcumin and camel milk are known to be beneficial. We have to, of course, avoid sugar, additives, pesticides, etc. We all are aware of a ketogenic diet, which has just enough protein, but less carb and high fat. This is also beneficial. So with terms of micronutrient supplementation, we've seen that in more than half our kids, we have to supplement vitamin D. By the way, vitamin D is manufactured when our children play in the sun, because when the sun comes in contact with the skin, natural vitamin D is produced. But nowadays, people don't go out in the sun, kids don't play, everybody's indoors on their screens. And that is why there is a deficiency of vitamin D. So we may have to supplement this. And we may have to give folinic acid. So as you can see, the management of autism is now multidisciplinary. There is rehab and diet and hyperbaric oxygen and biomedical treatment, and cell therapy is one part of it. Okay, but we need to do all of this together.
When we came here to NeuroGen,
so this is just a set of videos of patients talking about the changes they've seen in the kids.
When we came here to NeuroGen, she was totally nonverbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C for cat.
magically the water came out from the mouth, mama came out from the mouth.
F for fish.
I remember the first day she called me mom, I cried. I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on a time. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen, and he's able to understand more, and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
Started responding to her name.
Is Eliana big? No. Eliana is a? Eliana is a good girl.
Then his writing has improved. He can read
C for dog.
single word to sentences.
My girl finally she had speech. Please give me food. Can we go for a shopping?
Where are we Cranberry. And orange.
Orange.
And mixed fruit.
Mixed fruit.
High
Yeah,
five.
high five.
Now he is able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life. I taught him my phone number for emergency purpose. I also taught him the address. He is able to tell me full address and he's able to write it down so that if anything happens, he is able to say my phone number.
He understands emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I have seen a lot of huge differences. It's like giving a second life to a child.
So that is some parents. We'll see just one or two videos more which are a little more detailed. We'll see them later. So then we'll talk about cerebral palsy. Now in cerebral palsy, there is more severe damage to the brain and it affects the body more. In autism, the mind is affected, speech is affected, behavior is affected. In cerebral palsy, the body is affected. So it may either be one side of the body or just the lower legs or the entire body. So there are different types of cerebral palsies and you can see the damage is far more extensive. We saw in autism, it was a light blue damage. Here it's a darker and a more extensive damage. And there are some medical managements we have for spasticity, tightness, anticonvulsants, but they really don't take care of the brain damage per se. There are some surgical treatments available, but they only also have a partial help. But with our cell stem cell therapy, you can see this is the damage before, and you can see post cell therapy, the damage is completely gone. So the damage of cerebral palsy, although it is more severe than that of autism, can also be reversed. And this is our scientific paper that was published in the journal Stem Cell International, which was a clinical study showing the benefits of mononuclear bone marrow mononuclear cells in cerebral palsy. We had that paper was of 40 patients, and these are the results. You can see oromotor skills, speech, neck holding, sitting, standing, walking, ambulation, muscle tone, upper, lower limb, trunk, cognition, all these things improved. And these are different types of cerebral palsies, and these are just the results. And again, you can see above and below the changes. We have got a total of now 112 scientific papers. So what is the meaning of scientific papers? So in the medical field, there is something called peer-reviewed papers. Peer is your equivalent. So when somebody outside of you studies your data, evaluates your data, and authenticates it, that is called peer review. That means somebody outside of you has said that what you are saying is correct. And when that happens, it gets published in scientific journals. So we don't have one or two, we have over 100 papers in various international journals in different topics from autism, cerebral palsy, and all of these. In autism itself, we have 17 papers and we have written chapters in textbooks. So these are medical textbooks that doctors use to study. So in this book, Recent Advances in Autism, they've introduced a chapter, Stem Cell Therapy in Autism, and they asked us to write this chapter. So we wrote this chapter. Now, we have published a total of 26 books. There are books written for medical doctors and specialists. There are books written for therapists, rehabilitation therapists. But what we found after we wrote books for doctors and therapists, that most of these books were being read by parents. So after that, we started writing books for parents. We have a parent guide for autism and a parent guide for cerebral palsy and a parent guide for muscular dystrophy. And all our books, every single book is available free of cost. So you can ask for hard copies, you can have soft copies. They are available from our website and on demand. So all these books, and they're very comprehensive books, they are all available to you without any cost. We have treated over 16,000 patients from 103 countries, from all the 6 continents of planet Earth. So from very far away, patients have been coming to us from different parts of the world for treatment to us in NeuroGen in India. We work out of 2 buildings. There is the main NeuroGen building is 11th floor facility dedicated for this work only. And we have a smaller facility, which is the KLS Wellness and NeuroGen Annex. They're both very close to each other, and our work is done in both of these. Before we end, I'd like to share the views of the Honorable Prime Minister of India and the President of the United States on stem cells. So I'm very fortunate and blessed that in a book that I have written, this is a book that I have authored, Honorable Prime Minister Shri Narendra Modi ji has written an introduction. It's a real privilege that Narendra Modi ji has written an introduction for a book of mine, and that is myself giving Modi ji a copy of that book. He is somebody who has a great interest in stem cells, and now we'll see his views on stem cells as he spoke in the Indian Parliament.
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या हम गए तो वहां गए उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें
So that is the Prime Minister of India talking in the Indian Parliament about stem cells. And now we have the former President of the United States, Barack Obama. Let's see what he has to say.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary. Today,
the President of the United States talking on stem cells. So just to conclude, all the work we do is done with permission from a health ministry registered institutional ethics committee. So our work has oversight. My initial set of conclusions are that today newer imaging technologies are giving us much more information about what parts of the brain are affected in autism. So we must make use of these imaging technologies, which unfortunately is not being done worldwide. Then there are newer biochemical investigations, which is giving us a better understanding of the metabolic pathways. These are very simple blood tests. They can be done in every country, and the corrections of this are small, but they can have beneficial effects. So we recommend that as well. What we believe is that new comprehensive multidisciplinary treatment, which involves cell therapy, neurorehab, integrative therapies, will address these underlying pathologies, therefore reduce the symptoms and improve the quality of life. We have shown to you through our clinical work, through our scientific publications, that these treatments are safe and they are effective. To be noted that cell therapy is not a cure for autism or CP. It has to be combined with some conventional and comprehensive rehab and medical treatments. And it's not a standard of care, but maybe a clinical option. Now, what we've also noticed is that best results are achieved when we as parents accept our child the way the child is. We all love our children, but we all don't necessarily accept them the way they are. We have expectations. So we have to remove these and see what the child can do best, but accept them the way they are. It's very important that parents have a complete understanding of what is happening to the child. So for this, you need to understand, talk to the doctors, the therapists, do the scans. You have to know what is happening with them. We've seen that when the whole family works as a team, the results are much better. Normally, when it comes to autism, the sort of day-to-day care, the day-to-day responsibility is on the shoulder of the mothers. But we've noticed that when the fathers are also actively involved, when they're engaged, when they are proactive, when they're, completely involved in the treatment, management, and therapy processes of the kids tend to do better. We found that when you have the whole day schedule, there should be a fixed time for everything. That seems to work better. Obviously, cell therapy helps, comprehensive rehab helps. We have to correct the micronutrients and we have to do the integrative therapies. So this is my final conclusion. This on the left-hand side is the conventional treatment that you've already undergone. You all have been to some kind of neuropediatrician or developmental pediatrician or psychologist, and you've been given a diagnosis. This has already been done for you. All of you have been advised rehab therapies, and I'm sure all of you are already taking rehab therapies. Some of you may have been given medicines like resveratrol or melatonin for hyperactivity, sleep, etc., and maybe you're taking those. Almost no investigations are done. I'm sure none of you have a PET CT scan. Some of you may have an MRI, but most don't even have the MRI. Nobody's looked at the vitamin D levels, the folic acid levels. We have B12. We've looked at none of that. No, very few kids have had a gut microbiome tested. So specialized tests have not been done, and you've been told that there is no definite treatment for the child. Now, look what's happening with us at NeuroGen. First, we give, apart from the diagnosis, we are doing the brain imaging, and we are showing you what is happening in the brain of your kids. We are doing genetic testing, not been done for you before. We are studying the entire gut microbiome. We offer you a comprehensive rehab program. We are doing a stem cell therapy. We are offering integrative therapies that are oxygen-based, like hyperbaric ozone. We are supplementing the micronutrient deficiencies. We are using glucoverin, and we do gut cleansing. So there is so much that can be done, and all this has tremendous effects. So with that, I'd like to thank you for your attention. I'm open to any questions that you have. So the cost of the treatment, you have to contact our hospital administration. They will give you the costing because it depends on the type of accommodation you take. It depends on how many days you stay. We have a 1 week and a 2 week program. So there are several things in the cost. So I suggest that we'll be sharing with you a contact. So are there any side effects? So the thing about side effects is that there are two immediate side effects and long term. So immediately, well, 10% of our kids may have, headache for 1 or 2 days, maybe a vomit, pain at the back, but this lasts for just a day or so. The only serious side effect is that 3% of our children can develop epilepsy. But this happens more in kids who have a history of epilepsy. It doesn't happen in kids who don't have epilepsy before. So for practical purposes, there are no major irreversible side effects. It's a very, very safe treatment. I explained already leucovorin and MTHF. I'll repeat it again. There is a vitamin B9. We take it in the form of folic acid, which is inactive. It has to be converted into an active form, and there is a gene defect that doesn't let it happen. Our tests show that 73% of our kids have that defect. So leucovorin, which is folinic acid, bypasses this and helps the folate to get into the brain. So it's just a way of bypassing. There's a block, and we are trying to bypass it. So that's what leucovorin does. We've been using it for a long time now, and we found that speech returns much faster when we combine it with our stem cell therapy. We find that speech comes back faster, but there is the other side that it increases the hyperactivity. So we have to delicately manage both. All right, I'm going to see why is there a need. So you asked why is there a need for multiple times. So this all depends on the amount of brain damage. So you saw that PET CT scan, you saw that blue damage. So if the brain is 15% or less damaged, they require a single treatment. Now, that is a very small percentage of our patients. If the brain damage is 15 to 30%, we call it moderate, and they require 2 treatments. If it's 30 to 45%, they require 3 treatments. Now, the majority of our children have between 20 to 40% brain damage. So they will require 2 or 3. So that it's required again only because in those children where the brain damage is more than 15%. In children where the brain damage is mild, less than 15%, one treatment is adequate. How long will it take to see improvements? Well, it takes 3 months to see improvements. We have noticed in all, actually, little improvements start right away, but in 3 months, you see very good improvements. Are there any changes or paralysis in the child while doing? No. We have done over 16,000 children over the last 16 years. We've never had anything like a paralysis or a damage, or we've never had any child become worse than before immediately after the treatment. So that doesn't happen. So no, absolutely no. Hi, doctor. I have a son who's on the spectrum. He's 3.5 years old. We got his diagnosis here in Canada, but there is no proper help that has been started for him yet. We have been doing everything possible to improve his sleep. Can you please give us some advice on how to improve his sleep and what could be the cause of it? See, the thing is, in autism, no, you can't improve things piecemeal. You can't do patchy work. You have to treat the child as a whole. So you can't just treat sleep. I mean, if we could just give melatonin every day and we can find that the child will be sleeping, but that's not an answer. That is just suppressing the problem. So instead of addressing specific problems, it could be sleep for somebody, it could be hyperactivity for somebody, it could be educational abilities, reading and writing for somebody, it could be toilet for somebody. We don't go trying to fix that. We fix the brain damage that is responsible for this. Once the brain gets repaired, all these symptoms over a period of time will go away. Yeah. All right, so I gave Leucovorin to my daughter. After that, she was so hyper. Will it be different? Yeah, so I agreed. I mentioned that after giving Leucovorin, children do become hyperactive. I mentioned that in my slide as well. However, when you combine Leucovorin with cell therapy, we find that things are much more under control because the cell therapy is also repairing the brain. And this combination seems to work the most beautiful of all. So you combine cell therapy with rehab, with oxygen therapy and glucovorin, and we believe you get the best possible results. How much does it cost for stem cell therapy? So, like I said, in any medical seminars, as doctors, we don't discuss cost. These are informative lectures, so costing is never discussed in a lecture. For that, you have to communicate with the hospital administration or your whoever. So they will guide you as to the costing. Thank you. My child is all right. Great, Jagdish. Thank you, Jagdish. You mentioned that your child is doing well after 3 SCTs. Thank you for sharing that, Jagdish. Means a lot to us. All right. So we have. No, you can't. So somebody asked, can autism happen with 0% damage? No. If the brain is working normally, there can't be autism. This is what our research has showed us. Because we've done, we've looked at brains of kids who don't have autism, and we've looked at 7,000 brains of kids who've had autism. And no, if the brain has no damage, there will be no autism. Do you prescribe leucovorin after? Yes, we do prescribe. Freeman is asking, do we prescribe leucovorin? Yes, leucovorin is part of our treatment protocol, but we do it with the detailed testing. We do a very detailed biochemistry. We identify if leucovorin is required. Only then we give it. So it's part of our treatment protocol, but we are selective. We do an evaluation, we decide if it's required, and then we do it. All right, I seem to have answered all the questions. If you have any more questions, all right, I'm open to any more questions that you may have. All right, if there are no more questions, I thank you for your time. I do apologize for being about 5 or 10 minutes late. It was a little technical issue. So my apologies for that. I hope the lecture was informative. I hope the lecture was useful. I hope you got all the answers that you wanted. In case any of you want a more detailed discussion with me, we have, for all of those who've participated here, you can have a one-on-one virtual consultation with me. It's free of cost. It won't cost you anything, because very often parents don't like to discuss their children in a larger audience. So this is more for information. But should you want a more a one-on-one with me, that is possible. It does take some time. It may take about a week or so to set up an appointment. And the way to do it is, I'm going to share a number, and I'm going to say it verbally, so maybe you can make a note of it. You should contact Mamta. Her number is +91. That's the code for India. 90 900 33336. I'll just repeat that. +91, which is the code for India. 90 900 33336. This is Mamta, and she will, if you want to consult with me 1:1, like I said, it's already free of cost. You will have to message Mamta in this number, and she will set up an appointment with me. I look forward to having further discussion with you. I thank you for your attention, and I do look forward to seeing all of you in India sometime soon. Thank you so much.